What would you say if I told you you can virtually eliminate the possibility of you ever having another cavity in a tooth for the rest of your life? Even more importantly, what if I told you that you could help prevent your children or grandchildren from ever having another cavity or ever having their first cavity for that matter? What if I told you that your children and grandchildren, if they're below the age of 10 or 12, will probably never have to have the painful surgical procedure of having their wisdom teeth cut out?
Yeah, so my name's Dr. Steven Lin, and I'm a trained practicing dentist. I'm in my clinic at the moment, and my path in my career has been following the story of how food and nutrition affects the oral cavity and the dental diseases that we see very commonly in society today. Yeah, it's difficult. There's a huge learning gap, and there's so much research that has come out in the last 10 to 20 years. A lot of professionals don't have the time, or haven't had the opportunity to be able to educate themselves in that. And then the application into practice is very difficult. Dental practice, for example, is very regimented, and the practices are designed like that because things go wrong. It's difficult to practice in the mouth. It's hard to put restorations in. Dental disease is a difficult problem to fix, and that's why dentists are very set in their ways, or the training is very set in its ways. So I'm seeing a patient with moderate to severe gum disease in their mid to late 30s. And the issue is that their blood sugars are out of control, and they're pre-diabetic. They haven't been diagnosed by their doc yet. And until they get that diagnosis and we start understanding that their diet is controlling their or pushing them down the road to insulin resistance, then I'm never going to be able to control the gum disease.
And you may not know this about me, doctor, but when I started this health improvement journey for myself, I was morbidly obese, pre-diabetic, had severe gastric reflux, and I had a substantial amount of gingivitis or gum disease. And as I've kind of progressed from eating the standard American diet and moved kind of to more ancestral, primal, paleo, and now ketogenic, and then for the last 14 months, I've been almost exclusively a fatty meat carnivore. My gum disease is completely gone.
Yeah, so it's an excellent question, actually, because a lot of people have this issue. And if they go on a healing journey, they'll actually find that the tissues settle down and then you don't have active disease. Gingivitis is an inflammation of the gum tissue. Gum disease is where it progresses to periodontitis, and that's a chronic infection of the bone. And so if you floss your teeth, or even if you brush and you see some blood, that's inflammation of the gum tissue and gingivitis. That can progress to periodontitis. And all periodontitis is it's an autoimmune reaction of the body to break down the tissues, the collagen ligament that connects the gums to the bone. And so what happens if you have it long enough, the bone starts to run away. And this is what dentists will measure in their offices, and they'll tell patients, and they'll clean around that interface between around the ligament and the root of the tooth to make sure that calcified plaque isn't getting built up there. But so what happens if you lose attachment and you lose bone around the tooth? It is difficult to regrow, but you can stop the process. For most people, if you stop the process and you prevent it from going further, yes, the tissue will resolve at its point of loss. You're not going to grow back. You can gain some attachment back. So the measurements that the dentists take, they'll measure the actual pocket. You can gain some attachment, which is how the gum reconnects the ligament to the tooth, but you won't regrow the bone. So some of those measurements will be with you for life, but that's fine. That's okay, because that's where you're at. That's your journey, and your teeth are going to be okay because you're continuing to to give them the raw materials they need to maintain both teeth. The main thing is that that inflammation profile is gone and it's not progressing.
Annotated and summarized, easy to share with loved ones. The description below the title for this video has these summary points.